Thank you. Care better, perform better, grow bigger, grow together. Those 8 words, 4 goals, sum up Northwest Kidney Center's strategic plan, our bold direction for the future. Thanks in large part to the incredible support of all of you and so many other partners and supporters in the community, we're advancing that ambitious agenda at an unprecedented rate. I'm excited to give you a brief update today about how your support is driving our achievements. First, care better. A great example of how we strive to provide even more effective care to our patients is why you're here today. Food and fitness play a critical role in kidney health, and so we constantly seek better ways to help our patients harness the power of their own bodies to respond to good nutrition and exercise. In a few minutes, Northwest Kidney Center's longtime lead dietitian, Katie Wilkins, will tell you about the services we provide around food and fitness. It's part of the commitment we have to ensuring that we care holistically for people who entrust their health to us. We've also launched a palliative care program to help our patients manage the symptoms of kidney disease that interfere with their quality of life: pain, insomnia, depression, all managed by a team of specialists who make life better for those we serve. With a palliative care nephrologist, social worker, and nurse, this first in the nation renal supportive care team helps patients and their families make informed decisions about how to best live their lives with kidney disease. And when it comes to care tomorrow, we're fostering a brighter future with our support for the Center for Dialysis Innovation in collaboration with the Kidney Research Institute. As I told you at last year's breakfast, when we had just made our initial investment in the center, this research is focusing on real innovations in dialysis technology, the first since long-term therapy was invented in our city more than 50 years ago. A key research project at the Center for Dialysis Innovation is the wearable kidney, not just perfecting how it functions, but looking at how real people will interact with this trailblazing device. So what's the most convenient shape and size? Would people like to put it in a purse or a backpack? How can we make the wearable kidney more effective and comfortable? This human-centered design has great potential for the future of dialysis. Those are just a few ways we are caring better for our patients. And we're also performing better. For many years now, we've been rated among the very best dialysis programs in the entire nation. But that doesn't mean we don't keep looking to improve. For example, we're executing through our strategic plan a process improvement system. We call it Kaizen, which involves listening to our frontline staff and our patients and our doctors and engaging them in helping us design more efficient and effective ways to not only improve, but to sustain improvements. Performing better also means becoming better stewards of our own resources and the environment. We're now using a water treatment system called Aquaboss in many of our clinics. It's a new way to treat the immense amount of water that we need for dialysis. Aquaboss uses heat disinfection instead of chemicals, and it's a greener approach that saves 40% of a dialysis clinic's water usage, which is usually around a savings of 2 million gallons a year of water for just one clinic, and we have 16. Caring better, performing better, and growing bigger. There couldn't be more exciting news to share with you than to report on our phenomenal growth. When I came to Northwest Kidney Centers in 1998, we had just opened our 7th dialysis clinic, and today we have 16, and soon there are more to come. There's never been a more expansive time in our history, with our treatment growth surpassing 15% over just the past 3 years. Our newest clinic just opened 2 months ago in Federal Way, and we'll open a second clinic in that city this year. A few months from now, our Kent clinic will expand by 50%, and then we'll open a new clinic in Fife, our first in Pierce County. By the middle of next summer, we'll open our clinic number 19 in Rainier Beach. As skyrocketing housing prices push more and more lower-income people into King County's southernmost suburbs, and because poverty has a direct correlation to conditions like diabetes and high blood pressure that can lead to kidney disease, this growth plan is targeted and responsive. Smart growth in the areas that need us the most. Whew, I'm breathless. So all of these efforts to care better, perform better, and grow bigger are aimed at addressing kidney disease, both downstream with improved care for people living with kidney disease, and upstream working to prevent kidney disease. And now to goal number 4, grow together. We've partnered with the American Diabetes Association and African Americans Reach and Teach Health Ministry on several initiatives, include teaching classes on diabetes prevention in communities and churches. By working together with other organizations in the community dedicated to better public health, we can slow the leading cause of kidney disease, that terrible illness, diabetes. All of these endeavors require the very best staff. We employ 750 people, all dedicated to providing the very best possible care to those we serve. I am very proud of our staff. Please join me in thanking them. They are incredible. Our organization is also blessed by great volunteers, many of whom are here today. I want to close today by honoring one of these very special volunteers, Muffle Jaycox. Muff passed away last June from the complications of a life with diabetes and kidney disease. Muff was so active in our Northwest Kidney Center's community outreach. She told her story to many audiences with vim, sharing her joy of having a baby after her first kidney transplant. Her miracle child, Maddie, at age 12, traveled with me to Washington, D.C. with Muff and her husband and an NKC delegation, where this family wowed our senator and congresspeople with their passion for kidney research funding. Muff volunteered every year, even most recently as last year, at our service of remembrance for those who have passed. So it's fitting today, upon the first anniversary of Muff's passing, that Muff's family has made a unique gift for this Breakfast of Hope. They've provided the first ever match gift in the history of our 16-year breakfast, a generous match gift of $15,000. Every $100, yeah, isn't that wonderful? Wonderful. So every $100 given above our suggested donation minimum of $150 will be doubled because of this match. Muff was featured in our 2007 Breakfast of Hope video, and Muff and Maddie stood here and made the ask for gifts that year. Muff is smiling in heaven right now, knowing she can again, through her family, raise donations to support our patient mission. On behalf of everyone who counts on Northwest Kidney Centers for their very lives, thank you for being here. Thank you for your support. And now, let's welcome Northwest Kidney Center's Nutrition and Fitness Manager, Katie Wilkins.